This is the Life Insights Revamp webinar with Dr. Char, using biofeedback to assess and treat dental patients. And it's a continuation of the last webinar, except today's webinar will have more of a focus on dentistry. And it's a great topic for Dr. Char to cover because for the past 47 years, he's been a practicing holistic dentist in the state of Hawaii. In fact, he founded one of the first holistic dental practices in the state, and he pioneered many of the holistic techniques being used by other dentists in the mainstream today in the realm of using biocompatible materials, not using toxic metals, and other sorts of techniques and methods within the realm of holistic dentistry. All right, so the webinar will last 1 hour today. And as I mentioned before, there is going to be a Q&A session at the end of the webinar, a live Q&A, where we're going to turn everyone's microphones on, and you can just speak into your microphone and ask Dr. Char if you have any questions. You can alternatively click on the Q&A button in your Zoom webinar interface, and that will allow you to type in questions. It will allow you to type in questions during the webinar, and we can answer those questions as the webinar goes along. And if we don't have a moment to stop, we can answer those questions in the end during the live Q&A session. All right, so without further ado, we're going to start the main webinar now. And Dr. Char, you can take it away from here.
Okay. Well, hello everybody. Welcome to the holistic dentistry portion of the Life Insights. I've been practicing dentistry for 58 years, of which 47 years I've been a holistic dentist. But let me tell you what the difference between holistic dentistry, biological dentistry, or mercury-free dentists. I see a lot of people call themselves holistic dentists. That means you got to cover the whole body. But when I see a lot of people advertise, or especially on YouTube, and they show their method of how they remove mercury fillings, it's more than that. It's called, if you do that only, there you'll call mercury-free dentist. Holistic dentist covers everything. So I can remember all the relationships according to what Dr. Bo taught me, Dr. Glesh, and all the rest of the holistic pioneers. But I was able to put it into the Life Insight program, and I organized it. But what I did basically in 1980, I wrote a book called Holistic Dentistry Volume 1 and 2. And that's 1980, and I put the holistic diagnosis approach to the cause. And I had some of the things that you need to do to properly remove mercury fillings as well as other types of toxic metals in the body, like a partial, or which has nickel in the partial metal, or maybe you have orthodontia, you have some kind of nickel in there. And so you get all kind of different toxins that come in the body. Some people can tolerate it because they get a high immune system that can retard some of the effects of that toxic metal. But a lot of people don't realize that they have a galvanic purpose to the dental fillings, that they can trigger off different currents going through the meridians to the related organ and tissues. And you might have somebody come in and they say, oh, I went to the doctor and he tested my kidney and I was getting problems in that location of the kidney. Did all the tests and couldn't find anything. And then we found out that looking at the anterior teeth, we found a teeth that's related to the kidney. And then we started to see that that tooth was either infected or they had some wear, abrasion on it, trauma, and that affected the related organ itself. And so we balanced that out because we were working on the teeth and cleaning it up, as well as balancing the energy through that particular related things. Could be your kidney, could be your genital problem. And then things start to improve. See, the doctor didn't see it on a typical physical test, but it's energetically, we were able to help the patient feel more comfortable and get rid of some of the symptoms. So, like I said, we're going to teach you all the different facets. We put it into the Life Insight, the category of the dentistry. We're going to go get all the different characteristics, all the different things that's related to each tooth. I'm going to show you how it happens. I'll walk you through some of that so you can really understand how the relation of the tooth to other parts of the body. But also, if you have Bowles charts, Dr. Bowles charts or Gladys charts, you will see a lot of relationships. But then, how do you know it's related? You can just look at it and you say, well, looking at the medical dental history, you say, well, I don't see that there. But the patient said, I feel the symptoms of that particular organ or the side of the body intermittently. So it's not consistent. And pretty soon it gets too bad. Then you say, I got to go to the doctor. Now you see it on a physical level. See, when the doctor checks it with his physical instruments and everything, testings, he starts saying, oh, something's wrong with your liver, or maybe the blood profile shows that. See, but you want to get it before and balance it out. So you're going to find out which is the cause, the tooth or the organs. Is the organ pulling away from the tooth and the tooth getting sensitive, or the tooth drawing energy from the organs and the organ itself start to have intermittent dull, aching, pain, and you might say, wow, I don't know what's going on here. So I'm going to show you some slides and take you through a course. Now, this is basically a big improvement since I started in 1980, writing this book. And so there's more things now because technology wasn't available at that time. So I couldn't use some of the like ozone treatment and all that. But I'll have it in my presentation here. So let's start with the slides. Okay? So I'm going to take you through the different slide here. And the first thing you see is the book I read. I have my holistic dentistry in there. And it's called Volume 2, Holistic Dentistry Volume 2. And in 1980, and it's into 16 university libraries. And as you can see, a lot of things deal with posture, cranial osteopathy, and you can see medical dental history and so forth. So we're going to take you through another phase after this right here. And we take you through this slide progression. So the next thing you see will be the potential meter, which I use in 1980. I bought it from Germany, from Dr. Boser. And it detects the millivolts and milliamps of the metals or dental materials, and how is it compatible to another type of metal in the mouth. Okay, some people use kinesiology. Right here you can see muscle testing by this doctor. And then you say, okay, we have to clean the environment up in the office and also protect the doctors and the staff as well as the patients. So you have protective clothing, disposable masks, sterile gloves, glasses, paper, filter high vacuum, safety goggles, disposable goggles. And then you have the doctor filtration mask. You see the doctor's wearing over there to protect himself from breathing all the vapor from the mercury, especially when we're moving it. And then the patient has an oxygen mask, rubber dam, and you have the high vacuum system. So all that is essential that the office who moved Malcolm should have. Then we also have ozone, water, and gas. You know, that helps because when you get deep to the cavities that invade close to the nerve, you're going to see basically that the filtered water or some of the tap water from the city is not good enough. It might create bacteria and cause infection in the tooth itself. And this way you get sensitivity, soreness after you put the filling in. So also, the water that you have should be clean because it goes down the sewage and causes pollution in the city sewage, and then goes to the river and down to the ocean. And so you're polluting the environment. So you should have traps in your sinks to be able to capture the residue of the fillings that come out, or the fillings that are loose and they spit it out in the latrine. Okay. So your air conditioning, check the air conditioning and see if it's real cloudy, because a lot of times you have a dental office and the thing has central air and it goes all over the different offices. Now, if you ever wonder why you experience backache, stiff necks in the neck, number of physical ailments, or have a toothache, then you understand how the body is interconnected in a manner not only solves the physical, but the emotional, mental, and spiritual. Holistic versus biological, alternative, integrative, functional, complementary. So you're talking about, what are you? Are you holistic or you are the rest? What is truly a holistic dentist? Now, this is Dr. Bo's chart on the right and how he affects the different body meridians and chakras. Now, I have a whole list of here, the interconnection of the body dysfunction and diseases, the holistic diagnosis, treatment protocol to dental disease and illnesses. For instance, the diagnostic evaluation, the bioenergetic treatment consideration is the energy, medical or dental protocol. You have to look at that, compare both, and then some. But you're going to find that not everything in the medical dental history is recorded by the patient. You're going to find more than that when you go through a biofeedback equipment that we use. You will also see the teeth and energetic relations to the organ, tissue, glands, nerves, spine, and brain. Sinuses related to virus and bacteria, fungus. Tonsils and lymphatic blockage. Vertebrae related to organ and neural segments. Spinal segments and dermatomes. Irritation of the muscle, dysfunction and pain. Endocrine glands, hypo or hyper from metals. Neural effects from chemical, emotional stress. Intercostal nerves, respiratory virus. Cerebrum, neurotransmitters disarranged. Joints causes arthritis, osteoporosis. Nerve reflexes related to certain chakras. Dental foci of infection, why are there? Where are there? And holistic therapy with conventional dentistry. I have seen burning bladder, patients coming with burning bladder, and when we remove all the toxic elements in the front teeth, we found that they improved, they're feeling better. I had a patient come in from California, I live in Hawaii, and she had to do a lot of moving by herself, and she developed backache. Then when we checked it, it was related to a tooth. We fixed the tooth up, balanced the energy up, and the back pain went away. I had a patient who for years had a frozen left shoulder, and then when we found the correct tooth to that shoulder, we balanced the energy out, and the pain and the frozen shoulder had a better range of motion. So you see, there's a lot of things happening. And I've been to many different dental offices, especially in Europe, where I studied with Dr. Bo and Dr. Joachim Thompson in Hamburg. And I've watched their patient, and other things happen when they remove the fillings properly. Now you have a history of medical diseases recognized in America after amalgam was introduced in 1825. You have dental system pathology disorders. Several medical contents and characteristics. All these are in the dental portion of the Life Insights. Galvanic versus chemical dental fillings. Other toxic restorations, application, appliances causing disorders. Safe, biological, toxic fillings, removal, and biological restorations. You can test that with the dental category. What to do, mercury and toxic metal materials detoxification. And I went to Hamburg, Germany with Dr. Joachim Townsend. He had a patient, and they said they used to hear sounds and voices in their head. And when we removed the fillings, about a week later, that disappeared. It's interesting. And dull head pressure. I see a lot of patients with chronic headache, dull head pressure. Chronic fatigue, tired, depression. I would send them over across the part of where I live in, close to the airport, and send them across the state to get their shaved by my dental lab technician. And he told me the ride over there, when they left, the patient left, he to call me up and told me that the chronic pain they've been suffering for years has dissipated. Why I use dental homeopathy? I got my PhD because I found that Dr. Vo uses homeopathy to balance the toxic metals. Okay, radiesthesia, holistic remedies versus supplements. And then the general herbs for dental teeth. I have that in my book. Then the natural solution for dental disease, periodontal, gum disease, tooth sensitivity, bad breath, tooth decay, mouth sores, tooth erosion, dry mouth, or pharyngeal cancer, cavitation, oral surgery, orthodontia. I have all that in the dental categories. So it's easy to find out what is the indicator related to these particular dental disease to a particular organ or nerve pathways or meridians or organs. See, I can't remember everything without thinking about my charts. Now, I also have tooth yin yang on the organ clock. And we found out that some of the things disturb the liver, and the patients keep getting up at 1 to 3 o'clock. And I said, I tried everything, balancing the energy, using the sound therapy, using different lasers and everything, and never helped. And then when I go ahead and went to my different dental categories and tested that, I found out that the liver was a problem at 1 to 3 o'clock in the morning, getting up to go to the bathroom. And I started to balance that area. And then I improved. I skipped the 1 to 3, and then I had to work on the 3 to 5, which is the respiratory problem. And I don't have a respiratory problem. I have a slight mucus once in a while, but not consistent. And then he said, apply nutrition, and calcium, phosphorus, oxidative stress, pH balance, cholesterol, diet, food, and water. That's all in the dental category. Also have in dental categories how hygiene care and tooth you should use. Should you use electric or manual toothbrush, water pick, dental floss, what kind of dental floss, disclosing tablets, toothpaste, fluoride or non-fluoride, antiseptic mouth rinses, dental pick. And you see that used to be called Quantum Infinity Pro. I call it now, because I revamped it and reorganized the categories to Quantum Infinity Revamp. Now you get a new therapeutic modalities. Some people use kinesiology, but you can only use so much because you've got so many things you have to look for or remember. You might miss a lot of things that is related to the particular problem. And I can use sound vitality, which is the infratonic. And that helps reduce some of the bizarre type of dental pain that you may suffer from. Then we have a dental concern. If you wonder why you get back and neck pain, a number of physical ailments, when you have a toothache, then you need to understand that the body is interconnected in a manner that only involves the physical, but the emotional, mental, and spiritual. What are the dental concerns you might have? Do you have a healthy mouth? The dental materials in the mouth. Are implants safe? What kind of implants you talking about? Gold crowns versus porcelain. Is that I never use semi-precious because I found they have a lot of toxicity in there with the different types of metals combined with the gold. Remember galvanic compatibility. And partial dentures. Is the metal compatible? Resin fillings. Some are good, some are bad. You got to test that. You can do it, and I'm going to show you how to do it with the biphoton analyzer. Full denture. Some people had to use clear denture because the pink was not compatible to them. Root canal controversy. I never used root canal. I'll talk about more about that later. Oral surgery and natural medication. If you look to the right, you can see a panorex. And you can see after each, this patient had almost 20 implants, too much. And then you can see under some of the implants, you can see opaque area, opacity, of infection. And that's why this patient came in and she said, I can't get rid of this chronic headache. No matter what I do, I'll go back to the dentist. And he said, everything's all right. But when you carefully examine the implants, especially in the maxillary area, you see some of the implants beyond the flow of the sinus. That's why she's getting the sinus problems too. So be very careful when you do it. And on the bottom, you see before treatment, you see the cavity has invaded the pulp. And after that, they use root canal. But a lot of times, the root canal, sensory canal, can be filled. It's microscopic. And so you can see that it can be infected, as you see on the lower right side. So what do? You do an epiectomy? Would that take it away? But you see, remember, the tooth on the lateral aspects of the root has this accessory canal that connects with it. And then, so you have a problem with that. See, so you really haven't solved the problem because the periodontal membrane is infected with bacteria and everything, and it houses in the root of the tooth. Then this is a biphoton analyzer. It comes with the whole unit. And why I use it? Because you don't have to use electrodes. One thing, it covers a wider range better than the electrodes. If you got to cover the whole body, you got to put electrodes on your foot, you got to put electrodes on your wrist, you got to put electrodes on your head, and that doesn't cover the whole body. But this covers all the meridians. And I just said, a lot of times I check the compatibility of the patient to a certain dental material. And then what I do is I scan the patient see if it's biological compatible with his categories, and then I put it in the outwell. You can see the outwell. And then I program that with that, and then help material more compatible to the body. But if you have, say, some kind of gold crowns or semi-precious or titanium crowns or different kind of crowns, and that's causing the problem, just by balancing the body, it's not going to cover it all. You do this temporary treatment. Sure, the patient going to feel a little bit better, but it will come back again because you haven't got rid of the cause which still in the mouth. So people think, well, I'm going to just balance the amalgam fillings in my mouth, and then I'm good, because then the patient feels a little bit better at the time temporarily, and then he comes back again because you haven't got rid of the cause. So energetically, you can help the patient, and that's where Dr. Vo uses the homeopathic remedy by Heal Company. All the different kind of metals he has, a different homeopathic remedy like arsenic or mercury fillings and everything. So as you can see, scan this slides, and you can see all the different things I use to balance the body up before I put the restoration in the mouth. I put it into the biphoton analyzer. And if you got a big area where you got different kind of remedies and different got tinctures and everything. The biphoton analyzer has a coil that goes right around, wraps around, and energizes that area. You can see on the bottom screen of your screen the wire going across. All the different, so you can do more than one because the outwell might be too small to cover all the different components or things you're going to place into the mouth as restorations. We talk about all the different modalities. You see, this is a synopsis of what I just talked about. And you're talking about the x-rays, medical history and everything. I chart them on my chart here and I do a strategy. See, how many are root canals? Which one does a scanner picks up that it's incompatible or the energy is malaligned. And then you have the potentiometer testing of different materials and galvanic testing. And I have a chart here and it shows you all the connections of the teeth and nerves and everything to the body. And then I show the meridians. Up here in the upper part of the chart, you see my sensei testing somebody's teeth with sort of kinesiology, but not the old applied kinesiology. It's a little different, more finesse. So I used to do applied kinesiology, but using really the orthopedic way. But the patients got tired, the muscles got too tired. And I can test only a few. With Life Insight, I can test many, many, many more. And then it'll give me some things that I wasn't aware of and indicate that you should look at that problem. And then if you are familiar with the tongue, it gives you some indication of organs and information of different organs. You can look at that because all dentists see the tongue, but they ignore it. You have to look at the tongue for your diagnosis, and that's Chinese medicine. And then this is the setup. I'm going to go more on the setup of how you can scan the teeth. You can knock out negative emotion, stresses, and talking about improving your immune system. And on the right, there's Bowles charts or Gladys charts. I see how it's related to the teeth and it's related to the body reflex points. And you can balance it out if you get rid of the toxic metals in the mouth and everything. I'm trying to balance out the related organs with sound therapy. I use an infratonic. And then we come to the biofeedback. See, now we're talking about biofeedback. This is biofeedback. It's the Life Insights. I call it revamp. And I showed this picture before in my last presentation. As you can see, the green arrow on the right, we use an iPad and it's connected to a big 24-inch screen. And you can see the monitor and the patient looks at it. You can see all the sound waves. What happens is you are having the patient look at that to like a hologram, and that thing, the thought process goes into the right brain consciousness, or left brain first and the right brain. And so then it connects with anything that's in there, connects with them, connects with the frequency. And if it's the same frequency, it can balance it out. And then you can see on the lower left corner, you see the biphone analyzer, and you can see the cords connected to a hearing aid and a pad. And then you get single tooth relationship. You can do the single tooth by itself, find out what's the particular tooth that's causing the problem, or you can do by quadrants. So I have it all here. And then each one of these, if you look at the circle on the right, has a relationship to the different parts of the body. Yeah. And then you see, for example, a tooth relationship. There's an assessment we call assessment. Here's the third molar, for example, and it gives you all the tooth relationships. When you click on the particular tooth, maybe 1 or 16 come up, whichever tooth that is, then it gives you the relationship. If it is affecting the patient's body, in other words, the relationship where they're having a relation with the tooth and the different element in the body, muscles, organs, central nervous system, dermatomes, emotional, field disturbance, tonsils, psychological, limbic, jaw, meridian, nerve plexus. All these are in each tooth. And then it tells you which one is having imbalance frequency in there related to that particular tooth. And then you can go ahead physically and maybe check on the x-rays if you got any bruxism or wear, facetings of the tooth, and take care of that as a dentist on a physical level. Now, the tooth energetic balances. You get an organ, homeopathic, joint, spine, nerve, and psych. All these are homeopathic according to Dr. Vo and other people. So we took all those different things and we pointed out that you have an organ relation imbalance in energetic. You can use a homeopathic remedies, but you use this life insight category, and it provides some of the frequency that can balance that out. And you want to go further, you can go ahead and get the specific homeopathic remedy for that patient, and it will tell you which one to use. So it's very valuable because you can't think about everything that on a particular tooth that's related to it, that's malaligned in energy. If other than looking at a chart and just sort of guessing, this was actually scan it for you, and we're able to pick out the ones that are in balance, and you can balance it with the Life Insight while you're scan the patient. And then we talk about periodontal disease. I get a whole list of periodontal disease. And when you scan this, all these sections of periodontal disease, the one that's pointed to the patient will arise. In other words, you might say, okay, periodontal enlargement assessment factor. Well, you say, what's that? When you look at the enlargement of gingivitis, you say, okay, gingivitis, you get slight bleeding when you check the pockets and everything. And then you say, other than cleaning the teeth, scaling the teeth, what else do you have to look for? And then you go ahead through, and then the thing will pop out. Periodontal enlargement assessment, just click on that, and we'll give you some indication of what to use or what kind of medication, natural and organic remedies you can use. I don't use drugs. Okay, I don't have melatonin. You get fungal disease, diabetic, bacteria. All these are related to the gum that you can see, all different types. And naturally, some of them will. How come sometimes you clean you scale the teeth and then do a good prophylaxis, and then the patient comes back a week later and it's still inflamed? And you give drugs to it because you haven't found the cause yet. And then you go ahead and scan them. And then you find out that, oh, I might have to give this remedy or that remedy. But why wait till you have to see that? You do it before, like prevention, before you clean the teeth and everything, and then see if that will clean up and heal faster. Then you talk about energy overload, galvanic conduction, dental biocompatible materials, toxic teeth. I got it here, and I have a whole section in category in here, electric toxic dental material. It's not only the toxic, heavy toxic metal, but other types of materials like acrylic, or you might have some titanium, or different types of porcelain, whatever. And you can see, you can check it through the assessment and balances. And then we say, I found out that by detoxing the patient from these toxic metals, once I find it out, before I take the mercury fillings out or the infected different types of metal that's toxic in the mouth, I find that I do the detoxing first, maybe 5 days done before, And I give them Tramil, T relief. And I found out that the patients are less sensitive to my dental procedure, like sensitive to cold, sensitive to bite, just ache, the teeth aches. And that really helped my patients with better type of comfort. You don't have to go through the pain. My son had the second molar fillings replaced, and it took him over a year of sensitivity and soreness to get the two tooth stabilized after I gave him homeopathic remedies, of course, for that problem. And then we have something called bad breath. Drug antibiotic resistance, you get bad breath or a complication. You don't know what kind of dysfunction you have in the mouth. Might be TMJ, might be strained muscle, might be abrasion, maybe malocclusion. You don't know which one it is, other than looking in the mouth instead of guessing. Now you get dental dysfunction balance or hygiene, take care of bad breath, the nasal problem related to it. So the dentist can look, and a lot of times you think, well, this is the way I'm going to treat the patient, and then the patient goes through a certain period of time and may work temporarily and come back again. So when you get bad breath, how do you know it's just the mouth and teeth? Maybe it's the lungs, and then the lungs are coming from the lungs, or bad gut. So many things can happen when you have a bad breath. So I have all the particular characteristics of bad breath in the category. Then we go to the next step. And finally, we talk about, again, dental homeopathy. Used for headaches, toothache, dental homeopathy. In my first book, volume 1, Holistic Dentistry, volume 1, I have all the different dental homeopathy. And then we talk about radiesthesia, herbology. Now, which one do you use? And where do you get it? You as dentists can get it because you can get it from the different companies, and then you can be a wholesaler because you're a doctor, and then you make some income on selling it to the patient. The patient needs it. Or you get out a patient go to the internet and get it themselves, but you're going to pay the same amount. All these things, you say, if I do a patient and I just check them out, do I do it free? Well, yeah, they can use some dental insurance, they pay for examination. But when you give them remedies and everything, they have to pay. It's just like going to a naturopath or a physician. They have to pay for the drugs or natural. And you're doing the same thing. You're helping the patient. And finally, this is it. This is a setup. I showed you that before, and it's very simple. You need one room. You need a big room. You need yourself a chair, lounging chair, and you put the pad. You see the blue area where the patient's laying on there. That's connected to the biphoton analyzer, which is connected to the iPad or the Life Insight. So whatever goes there, the frequency goes to the biphoton analyzer. It goes through the Schumann resonance. You can do it broadcasting. If you saw a patient one time and they live far away, you can do it broadcasting. You can make your own homeopathic remedies as you scan them. You can go ahead and place a bottle of water, or alcohol, or whatever tincture you make it of. Put it out well, and then it will program that frequency in the bottle. And then you can give the patient to either spray their mouth or take some drops and put them in the mouth. And you're getting sound therapy. And you look at the screen, you get like a holograph therapy. So you're covering all bases. So that ends my presentation. And I'm going to give you a little dialogue on some of the strategy to use. I'm finished with my presentation. we're going to go ahead and tell you how to strategize. You get a new patient coming in. They know that you're a holistic dentist. You can present them with a consultation first. I charge $250 for the consultation 1 hour. And then I add, if they take the total package after I present it to them, then I do my diagnostic treatment, and then that takes me the longest. But if I just do the dentistry part, it might take me an hour. But if I do the whole body, it might take me 4 or 5 hours. So if I do the whole body, it's going to take me 4 or 5 hours plus the time away from doing the scan. I got to evaluate it. So my fee is usually $2,000. Then I charge $300 per visit. After that, usually 7 visits. And if they go ahead and take the whole package and pay me up front, which I require most of the time, they get a $50 deduction on the appointments. Thereafter, instead of $300, they get a $250. And the last appointment is free. See, so I feel like I throw in the consultation in free. So the last appointment is free. But if they stop the appointment after they do the evaluation, and they said, wow, I'm going to think about it and don't do anything, I just charge them the $2,000 and don't reimburse them the consultation fee. And that works good for me. How long does it take? Well, it might take 3 months, 3 months, 4 or 5 months, but you figure you're not going to see them every week. Right? After you stabilize them, it might take you, might be a month. Then you start spreading out the appointments instead of every week. They come in every 3 weeks and evaluate again and scan them. And you only scan the things that you see an initial appointment, or you can do a whole body assessment, and then you take each appointment, take it one chakra at a time and scan that and each individual appointment, or one particular specialty at one time. You can do that. I have it all charted. I have a sample of those charts that you can follow, and it's very simple, you see. And then you watch about 3 weeks, then you watch a month and a half. What is the progress of the patient? Are they getting better? Do they feel more energy? They were coming, a lot of times they come with chronic fatigue. They feel depressed and everything. Are they feeling better? Everything. And you make them do some homework. And then as you teach them certain techniques in your hourly or hour and a half appointment, you check them in the next appointment and tell them, show me what you did, what I taught you. If they're supposed to do it every day, if they're not doing it every day, you want to continue. Maybe they might say, oh, I forgot to do it. I'll do it tomorrow. And maybe soon tomorrow becomes a week and they don't do it. And so how are they going to progress in the healing? So you see those patients after a while, you might want to dismiss them, say, I cannot work on you anymore because you're not trying to really seriously try to get well. Because you don't want your reputation going around the community saying, the stuff don't work. But they don't tell the people that they didn't do what you trained them to do. See, and have education films and everything, and they get educated with that. So the next appointment probably the presentation will be on injury, either sports injury, occupational injury, any type of injuries, and how you can use the life insight to take care of it. So that is really exciting because I do a lot of patients with back pains and different knee pain, and they don't even report it on the medical dental history. And when I bring it up, they say, oh yeah, I forgot about it. Yeah, I will occasionally get these aches in my knee or aches in my hip, back, whatever, feet, that they had an injury before, maybe 10, 20 years ago. And we'll bring it up and tell you the location of it, whether it's ligament, cartilage, muscle, nerve, and bone. And then you go ahead and neutralize it because it's a habitual behavior lodged in the right brain, in the subconscious or unconscious. And it still affects them. and can affect the emotions. So you want to go ahead and balance that out, no matter how far away it was, maybe in childhood. And you see that happen. And then when you clear it out, you feel a lot better, get more flexibility, range of motion, less pain or any pain. And you said, oh, I'm fulfilled by my mission to get you well. So a lot of things will pop up if you do the whole body scan, and you get to some of the causes by clearing out some of the behavior syndrome, habitual symptoms that they may have that still lodge in the right brain in the memory. So any questions and answers?
So that will end today's webinar. And thank you everybody for attending. And we look forward to seeing you on the next episode. So stay tuned. Check your email for the next invitation. Okay, take care. Have a great day.
See you later. We call that sayonara.